Super excited to be in our new building here at 897 on Highway 287 in Broomfield. This beautiful space we're looking forward to using to work out of and serve clients and the people of Broomfield. We work with a lot of clients who are on Medicaid or Medicare, or maybe they don't have any insurance at all, and we do take some insurances. We are super proud of our team. We have a great group of clinicians, and I'm looking forward for you to get to meet some of them and hear about some more of our programs. We serve kiddos age 3 up to age 93. So we do individual therapy for kids, adults, teens. We do family therapy and we do group therapy. We have a great range of group health and wellness coaching. So there's a big range of services to help meet your needs. Welcome.
Taylor, I'm the care coordinator for Broomfield Mental Health Partners. I work in the Broomfield Behavioral Health Home for adults and children, and at the Broomfield Behavioral Health Home, we begin with an assessment where you work with a certified counselor to discuss your past, your present, and what brings you to Mental Health Partners today. From there, you may be assigned to the care coordinator who helps gather resources for you both within Mental Health Partners and from the community at large. Within the Broomfield Health Home, these resources include groups both for wellness and for therapy, as well as individual coaching, health and wellness sessions.
And I work primarily with older adults. That's my specialty. And I'm a licensed clinical social worker. So I'm able to help them with psychotherapy, with various case management details, benefits, understanding Medicare and Medicaid, and a variety of other things. I do treat regular adults and some children, not very many. And I'm also a licensed addiction counselor. So I deal with substance use disorders. And often substance use disorders co-occur with many other things. So I often end up using all of my skills together to help folks in those categories.
Andrea Blevins, and I am a therapist here at Mental Health Partners, coming up on my 4th year in May, which is really exciting. Mental Health Partners serves many different kinds of clients, but the majority of things that we see would be clients that are struggling with depression, anxiety, trauma, bipolar issues, family dysfunction, things that are going on with like addiction and wanting to get in recovery. So my specific role as a therapist is really helping a lot of individual clients. I see more adults and families and work with them with all of their attachment things that they want to work on. So I am trained in EMDR and work specifically with EMDR to help clients with trauma. And we know of course there are other forms of care, but that's one of my favorites to help people. And then I also lead our substance abuse and recovery group every week. So I have majority of clients coming in, and right now currently through Zoom to do our meetings, which is great. And we are working on many different issues that are involved into recovery and getting into a place of sobriety. So I love it. And in general, Mental Health Partners serves that same type of community. Other things that we do provide would be what we call care coordination, which is if a client doesn't want to do therapy currently, they can speak with our care assistant for supportive counseling while they see our provider, our psychiatrist, or our nurse practitioners. And then we also have a nurse on staff that helps with other issues, getting your medication. We do have many other forms here. We've got a supportive role, like a peer support therapist who leads a lot of groups. We've got tons of different groups to support clients, DBT, one on trauma specifically, of course my substance abuse group. We do have a new journaling group. We have a health and wellness coach that helps people. So I won't go on and on, but those are some of our great services that we provide. And I do enjoy really working with families and clients at Mental Health Partners.
Hi, I'm Lauren Wilkins. I'm on the home-based team for Mental Health Partners, along with 3 other great clinicians. On the home-based team, we actually serve families in their homes. So we meet them literally where they're at. We work with kids and families that are at higher risk and typically are involved with child welfare, juvenile justice, struggle with substance abuse issues, are at risk of going into the hospital or just coming out of the hospital. So by meeting them in their homes, it reduces the chance that we're not able to see the entire family system together at the same time, because sometimes it's hard to get everybody into the office, especially when you have so many other kind of different things that they're working through. And so we get to really serve people that otherwise might not get served. We use a wide variety of evidence-based protocols and modalities to best serve these families, and it's a really awesome, unique opportunity.
Clinical social worker on the Broomfield team, and I work mostly with small children up through the teenage years, and I offer evidence-based practices to work with kids who are struggling with anxiety, depression, and trauma. So some of the modalities that I offer are EMDR, cognitive behavioral therapy, narrative therapy, and let's see what else. There's so many, but those are probably the primary ones that I use. And I do see a lot of kids who have suffered a trauma, or they have anxiety, depression, they've experienced bullying. Some of them struggle with families who have addictions going on. So there are a wide range of reasons why kids come into child therapy. I work pretty closely with the parents and other professionals in the child's environment to work together to help the child solve their problems and have success out in the community.
Awesome. In addition to the services that we provide to our clients, we also do community support workshops. For instance, we have a basic coping skills for COVID times. We also do things like community first aid. We have a mental health first aid. We have suicide prevention. And so we're here to help support the mental health of our community.